In this module, we will be reviewing the cervical spine anatomy. So the vertebral column is divided into 5 separate groups. We have the cervical vertebrae, which is going to be the 7 vertebrae that occupy the neck. The thoracic vertebrae, we have 12 that lie in the dorsal portion of the thorax. The lumbar vertebrae, we have 5 which occupy the region of the lower back. The sacral vertebrae, we have 5, and then coccygeal vertebrae, this varies anywhere from 3 to 5. So the total number of bones is going to be 33 in a child and 26 in an adult. This is because of fusing as a child grows. The vertebral column also closes and protects the spinal cord and acts as a support for the trunk. It also supports the skull and provides attachments for the ribs. The column is supported by the hip bones at the SI joints, which transmit the weight of the trunk to the lower extremities. The spinal cord, which is enclosed and protected by the spinal canal, begins below the medulla oblongata of the brain, which then passes through the foramen magnum of the skull. The spinal cord continues through the first vertebrae all the way down to the lower border of the first lumbar vertebrae, where it tapers off to a point called the conus medullaris. So talking about true or movable vertebrae, these are going to be the 24 segments in the upper 3 regions. These remain distinct throughout life and pretty much don't change. The segments in the lower region are going to be called false or fixed vertebrae because they change during childhood. The sacral segments fuse into one bone called the sacrum, and then the coccygeal segments also fuse into one bone called the coccyx. So the vertebral column has 4 different curves that arch forward and backward. The first 2 are the cervical and the lumbar. They concave forward and are called lordotic curves. These are secondary curves because they are developed after birth. The cervical develops when a child begins to hold their head up or sit alone, and the lumbar starts to develop once the child starts to walk. The last 2 are the thoracic and pelvic curves. These are convex and they convex backwards and are called kyphotic curves. Primarily, these are called primary curves because they are present at birth, so they do not change at all. Looking at abnormal curvatures, we have lordosis and kyphosis. Lordosis is going to be the abnormal anterior concavity of the lumbar spine, where kyphosis is going to be the abnormal condition characterized by increased convexity of the thoracic spine. And then we have scoliosis, which is going to be the abnormal lateral curvature of the spine. So to start, we're going to learn what a typical vertebrae looks like, and then we'll go into each vertebrae, specifically looking at the C, T, and then eventually the L spine. But if you know kind of what a typical vertebrae looks like, it's going to be helpful when we do learn the individual CTL vertebrae going forward. So a typical vertebrae is composed of 2 main parts. We have the body and the vertebral arch. So the vertebral arch is going to be anything that is in that arch. The body and the vertebral arch also enclose a space called the vertebral foramen. This column, as they're stacked up on top of each other, form the vertebral canal, which is where the spinal cord passes through. So again, this is the body, this is the vertebral arch. The vertebral arch is formed by 2 pedicles and 2 lamina. These then support 4 articular processes, 2 transverse processes, and 1 spinous process. So starting out with the pedicles, these are short, thick processes that project backward, one on each side of the upper lateral part of the posterior surface of the body. The upper and lower surfaces of the pedicles are concave and are called vertebral notches. By their articulation with the vertebrae above and below, they form the intervertebral foramina for the spinal nerves and blood vessels. Looking at the lamina, again we have 2, one on each side. They're broad and flat and go backward and medially from the pedicles. Again, we have 4 articular processes, also known as zygapophyses. They arise from the junction of the pedicles and the lamina. There are 2 superior and 2 inferior articular processes. They articulate with the vertebrae above and below them. The articulation between these joints are called zygapophyseal joints. So we can see this definitely on the lateral side. So here's the superior and here's the inferior, and remember we have 1 on each side, so that creates 4. Looking at the transverse processes, these project laterally from the junction of the pedicles and the lamina, so these are the ones that go directly to the side. And then last but not least, we have the spinous process, which projects backward and downward from the junction of the lamina and the posterior midline. This picture right here is really showing you again a typical vertebrae with the articular processes. So we can see we have 2 at the top, 2 at the bottom, 1 would sit here, so then the superior articular process of the one below with the inferior articular process above would create that zygapophyseal joint. So moving on to the cervical vertebrae, again we have 7 total. C3 to C6 are going to be our typical cervical vertebrae, and they're going to look something like this right here. We will talk about C1 and C2 and then C7 separately. So looking at that typical vertebrae of the cervical spine, you're going to notice the transverse processes are perforated by the transverse foramen for the transmission of the vertebral artery, vein, and spinal nerves. And then something else that's different about cervical vertebrae, the spinous processes are short and have bifid tips. So you can see they kind of looks like a forked tip. So that's something special about that cervical typical vertebrae. And then lastly, talking about the 7th cervical vertebrae, which is called the vertebra prominens, because it has a long and prominent spinous process, which projects almost horizontally backward. You can palpate this on the back of your neck. So C1 is going to be named the atlas. It is a ring-like structure that has no body and no spinous process. It consists of an anterior arch and a posterior arch, 2 lateral masses, and 2 transverse processes. The arches extend between the lateral masses, and the ring formed by them is divided into anterior and posterior portions by a ligament called the transverse atlantal ligament. The anterior portion of the ring receives the dens or the odontoid of the axis. The posterior portion transmits the spinal cord. The transverse processes, they're longer than other cervical vertebrae. They do project laterally, as you can see. The lateral masses each have a superior and inferior articular process or facet. The superior articular processes are shaped for the reception of the condyles of the occipital bone of the skull. The articulation between the atlas and the occipital bone are called the atlanto-occipital articulation, and the inferior facets articulate with the axis or C2. So the axis is going to be the second. So axis is going to be our 2nd cervical vertebrae. It has a strong conical process arising from the upper surface of its body called the dens or the odontoid. This goes into the anterior portion of the atlanto ring and acts as a pivot or body for C1. On each side of the dens on the body are superior articular processes which articulate with the inferior articular process of the atlas. Talking about the relationship of C1 and C2, radiographic demonstration between C1 and C2 and the relationship of C1 to the base of the skull is clinically important because injury is high in the spinal canal, which can result in serious paralysis and death. Articulations between C1 and C2, the atlanto-axial joints, are normally symmetric, and so the relationship of the odontoid process to C1 must also be perfectly symmetric. And creating that perfect symmetric is where we would take that specific odontoid picture. So talking about intervertebral foramina and zygapophyseal joints of the cervical spine, we need to position the patient in a specific way to see those specific joints. So to see the zygapophyseal joints in the cervical spine, the patient will be in a true lateral position. So as you can see, we can see the zygapophyseal joints in a lateral view of the cervical spine. Looking at the intervertebral foramina of the cervical spine, the patient needs to be in a 45-degree oblique and the tube needs to be angled 15 degrees cephalad. This opens up those joint spaces and we can see the intervertebral foramina on that cervical spine.